So Liddy, just before we start with our examination of the cervical spine, I just want to ask for permission to palpate around the face, if I need to, around the neck, and if I need to move some clothing. Is that okay?
Yes, I agree.
Perfect, thank you. Well, I've obviously asked for permission to palpate Liddy, and I've obviously cleansed my hands. What we're looking for today is with TMJ, is we're looking at symmetry on left side and the right side. We're looking for differences in muscle bulk. What I'll get her to do first of all is I'll get you to, you can either open your mouth slightly or keep your lips together, but your jaws will be slightly open inside. Cool, and we're going to do just some very gentle motion, opening and closing. What we're also looking as Liddy's opening and closing is we're looking for slight deviation left or right. And as we can see as she is opening, there's a slight deviation to the right hand side. Okay, so now I'm going to ask Liddy to do a 3-knuckle test and see how many knuckles we can get in there. It's really important to make sure that she has at least 2 knuckles in to be able to eat. So Liddy, if you wouldn't mind. Okay, so she passes the TMJ test. In this part where the client is lying down, we're looking for palpation with our fingers, our finger pads. We're looking for differences around the jaw, so we're just slightly going underneath the chin to see if there's any possible swollen glands, any abnormalities. We're going round the side, again having a look at the masseters and the glands behind that. Again, we're looking for any abnormalities. Open your mouth and up. I've got my finger just at the condyle, at the joint of the jaw, to see how she moves her jaw. And again, I'm looking for any abnormalities anywhere that it's stuck. Close. So with TMJ mobilization, we're going to start off with the posterior to anterior glide. We palpate just behind the mandible, thumbs together very gently, and we're just mobilizing posterior to anteriorly. And what that helps with is opening, jaw opening. The next one we're looking at is the medial glide, and what we need to do is just pistol grip the chin, find your condyle, and the movement is we're pushing down laterally. So find that condyle, pistol grip, and we're pushing very ever so gently down, and just feel that soft squishy movement. So we're now looking at the next glide, which is the anterior to posterior glide. And again, this one assists us with mouth closing. So we're going to palpate around the mandible, very gently putting our pad of our thumb just behind, and we're going to posteriorly move the jaw. And always checking in with your clients. Is that okay with you? So what we're doing now is looking at the cervical spine and doing some observations. What we're doing with observations is we're looking at left to right, so we're comparing left to right. We're looking at muscle bulk and the height of the shoulders, so if one side is higher than the other. I'm going to now get you to, Liddy, to chin to chest and bend forward and back again. Let's go into extension and let's see if there was any hinging in that extension. So you're looking up to the ceiling for me. Good. So as we're going to go left and right, turning left and right, we're going to place our finger pads just along C6, C7 to feel for the facet joint as they're rotating and also any fascial restrictions. So I'll get you, Liddy, to turn right for me. Terrific, and the other side. And one more time. Perfect. And what I'm going to get you to do now, Liddy, is you're going to put your ear to your shoulder, and what we're looking for here is a natural curve on each side as she flexes, and again any compensatory patterns that she's doing. So what we're looking for now is we're going to go into the passive physio intervertebral movement, and what we're looking for in flexion extension is we're going to put our finger pads on the SB, looking for the gaps, and as we're moving her forward, we're just making sure that she's in a safe place, palpating for the SB and then the gaps in between. And as we're flexing forward, we're looking for gaps in between. Going back to neutral, we're looking at extension to make sure that that's closed. So what we're going to do now is the pivot lateral flexion. What we're going to do is we're going to have our pads looking for the spinous process. We're going to then go slightly out, in and down. And what we're looking for is the articular pillars. So as I'm looking for a spinous process, going out, in and down, I've got Liddy's head in neutral, and I'm going to flex to the right. And as I'm looking for, what I'm looking for is I'm flexing to the right, I'm looking for opening of the articular pillars on the left-hand side and closing of the articular pillars on the right. So now we're moving into PAVM, and in this section we're going to look at the PACVP. How I like to look for the spinal process is, to start off with C2, is we're dropping down from the occipital joint of the cranial, drop down to spinous process C2, and we're going to have our thumb pads on that spinous process. Our fingers are very gently onto the side. We're going to gather tissues and make sure that our thumbs are nicely straight, and we're going to move the tissue along with just a gentle press on that spinous process to move the vertebrae. We're also going to check in with our client. Lydia, are you okay?
Yes.
We're now looking at PIVM, P-A-U-V-P, and what we're going to do is we're going to find our spinous process, and we're looking at the edge of the erector spinae. We're going to pick that up with our thumb. Our right hand's going to mirror our left, and our thumbs are just very gently onto the articular pillar, and we're going to mobilize that joint. And what that does is contralaterally it's going to rotate the other side, obviously, and we're gently mobilizing that articular pillar. Now we're looking at dermatomes, and dermatomes are altered sensation from compressed nerves on the cervical. And what we're going to do is I'm going to ask Lydia, I'm going to get you to close your eyes, which she's already doing. I'm going to compare left side to right side, and any altered sensation, anything that's a little bit different, would you let me know? Terrific. So what we're going to do is I've got a very light cotton bud, and I'm just going to go one side and this side.
Yeah.
Feel any difference? Or is it the same or different?
Same.
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 Finally down to the palm. Same or different?
Same.
Same or different?
Same.
Same or different?
Same.
So we're looking at myotones. We're looking at C4 to start off with. I'm going to get Lydia to just slightly shrug her shoulders, and I'm just going to put a little bit of pressure and see if there's any resistance. Resist. Good, fantastic. Next one we're going to do is get Lydia to go in a 45-degree angle. I'm just going to provide a little bit of resistance. Good, thank you. Keep that elbow going. We're going to get Lydia to move forward. Good, thank you, and back. Good, thank you. And then I'm going to get Lydia to make little movements like this, and we're going to use similar fingers to provide resistance. Good, thank you. Good, thank you. Good, thank you. And good. All good. So now we're looking at a couple of cervical reflexes. We're going to look at the bicep tendon reflex, looking at C5, C6, and then we'll be going into the tricep tendon reflex, C7, C8. And just to see, what we're looking for is about 2 or 3 reactions to our hits. So I like to get that gavel going, and we're hitting right on our thumb. And we've had a couple of reactions on that one. And this one, we're just holding out about 90 degrees. And beautiful. So we've got a normal reaction on both of those reflexes. So now what we're going to be looking at is a neurodynamic test. What we're looking for is if the client comes in with no neck pain but has radicular pain down the arm, for example, paresthesia or numbness and tingling, sharp shooting, we want to be able to test whether it is from the cervical or from somewhere another region. First, what we're going to do is we're going to test for the medial nerve. I want to come to the client close by. I depress the shoulder. I'm going to have my hand touching hers, abduct, and I'm going to push. Ask the client if there's pain being produced. If there is, you stop the test there. Any pain at all, Lydia?
No.
No. So what I might do to provoke the test further is to get Lydia to rotate and flex her head to the other side. Does that increase the pain?
A bit, yes.
Okay, so then we will just reduce. Click. What we want to do is test the radial nerve. I'm going to get Lydia's thumb to go into her palm. I'm going to compress that with her fingers. We're going to pronate her arm, compressing my hand on her shoulders and bringing it down, asking Lydia, do you have any sensation or pain down the arm? Nope. So we're going to take that a bit further down, and we're going to ask you to rotate your head and extend. Any provocation? Any pain, Lydia?
Just stretch.
Just a stretch. Okay, so bring that down. So we're going to look, Lydia, at testing the ulnar nerve. We're going to do touch her fourth and fifth finger and push that down. So we're going to abduct, bring it close to the ear. Any pain or sensation?
No.
I'm going to also get you to look away. Any pain or sensation?
No.
And again, at any stage where the pain is being provoked, we're going to stop the test there. So one of the first of the orthos we'd like to do is, if we're looking at nerve root pain for C5, C6, we're going to ask Lydia to put her hand on her head. And if there's relief, we're looking really at C5, C6 root nerve pain. So in this orthopedic test, we're looking at cervical pathology and nerve root. So the distraction test, basically, we're going to see if we're going to alleviate the pain from nerve root compression. How we do that is we're going to put our thumbs just underneath the occipital point. We're going to gently lift up. If Lydia has any relief of root nerve pain, then we're looking at that nerve root pathology. So we're going to do the Sperling test, and we do the Sperling test if the client has no specific symptoms, but you're suspecting that there's a bit of compression on the cervical, and then maybe a bit of tingling down the hands. We're going to do this in 3 stages. We're going to do the compression to start off with. We're going to have our elbows gently on Lydia's shoulder, our hands intertwining, and we're just going to do a slight compression. Any pain?
No.
No. So if there's pain, at this stage, we would stop the test immediately. So we're then moving on to the lateral flexion. I'll get Lydia to turn to her side. We're going to still place our elbows very gently on her shoulders and compress. If there's any pain symptoms, then we would stop. However, if we're still haven't got any provocation, and in the last section of the Sperling test, I beg pardon, you're laterally rotating, extending. So we've got a bit more compression onto the symptom side. And again, we're going to lightly compress the cervical. And if there's pain provocation, then we're looking at nerve root pathology. So with this test, we're looking at the cervical artery dysfunction test. And if a client comes to you with any dizziness, nausea, vertigo, we want to check how the artery is compressed or whether it is or not. So to do this orthopedic test, I'm going to put my hand underneath Lydia's head. I'm going to extend and rotate her head to the side, exposing the artery on her right-hand side. Feeling any dizziness or nausea? Terrific. So you would repeat that on the other side as well.